just to finish here, there on healthcare, there's very little legislation in Wales about carers' rights, as is exactly the same in England. The healthcare obligations, the obligation of local health boards to carers is very limited. At the moment with Carers Wales, we're putting with Carers UK, we're putting together an amendment to a bill going through the English Parliament to place a duty on the equivalent of local health boards to assess carers. And I think that amendment will go through. And if that happened, it might produce a duty to amend the equivalent act in Wales, which is the NHS Wales Act. But at the moment, there's nothing in the NHS Wales Act that's specifically carer focused. The key issue, of course, is often hospital discharge, where there really is a need to involve carers. And as I've already said, the basic rule is the same in Wales. Carers do not have to provide care. They don't have to drop everything and care for a family member just because the hospital is screaming that they need the person out of their beds. Many family members don't like each other very much. Many family members are not very good at caring. And it's the responsibility of the state to provide in those situations, not to expect to just the family to just run around and accommodate the latest whim of the NHS, which has been closing beds at a stonking rate for the last 10 years, so that the bed crisis is increasing, forgetting COVID, because largely the NHS has been closing overnight beds for a very long time. There's a duty on the NHS and social services to work together to ensure safe discharge. And I think the point of departure in trying to understand that is an excellent Carers Wales fact sheet on the responsibilities of health and social services to involve carers in any of these decisions. So that's a very good starting point.